The 97th Agriculture and Commercial Show 2025 is in full effect in Lusaka. Now, you and I get to realize or know that the Nhima stand is also in operation. You who's not been here, or rather who is not yet on Nhima, or if you're an institution that is not on Nhima yet, and you're thinking of, well, where can I go to find out about their services, how I can self-onboard or we can get on board Nhima. They are exhibiting at this year's Agriculture and Commercial Show. Well, what a way for you to make your way here and find out what services they're offering. Well, to speak to us is, I don't want to say a guest. This is a familiar face on Sun FM Radio and TV. That's Mr. Kings. Now, Mr. Kings, here we go. This year's Agriculture and Commercial Show has come with a very wonderful theme that will speak to a lot of people. But first, I want you to speak to what Nhima is all about.
Thank you very much. I'd like to mention that Nhima, these are acronyms for the National Health Insurance Management Authority. And Nhima was established by an Act of Parliament, which is the National Health Insurance Act number 2 of 2018, and supported by statutory instrument number 63 of 2019. Nhima was established to manage and administer the National Health Insurance Scheme and also the National Health Insurance Fund. So talking about the National Health Insurance Fund, this is the fund where we pool funds. When we collect contributions from members, we put them in the National Health Insurance Fund, and when they access the services, this is where we get the money to pay for the claims at our accredited facilities. Then talking about the National Health Insurance Scheme, the National Health Insurance Scheme aims at providing a sound and reliable healthcare financing mechanism for the access of insured quality healthcare services for the Zambian citizens and established residents. So Nhima manages the National Health Insurance Scheme and also the National Health Insurance Fund. So this is how Nhima was established. And I also like to mention a bit about the mandate of Nhima, just what is relevant for this discussion. I'll mention that one of the mandates for Nhima is to register members on the scheme. So we have two categories of membership. We have principal members. We also have beneficiary members. So for example, as yourself, as you are employed by Sun FM, when you are as you are, I know you are registered. You are registered, right? Yeah, because it's mandatory. So when you were registered as a member on the scheme by Sun TV, you became a principal member. But it does not just end up there. You have a responsibility as a principal member to also register your beneficiaries. So you're entitled to register up to 6 beneficiaries, 1 legal spouse. I'm talking about legal spouse, yes, and 5 children. Then I'll mention also that you need to register up to 5 children below the age of 18. So it means when they become 18 years old, you need to register them as principal members. Then apart from the mandate of registering and also talking about membership, I would like also to take advantage of this opportunity. But currently we've registered over 5.3 million members on the scheme, which is representing about 27% of the Zambian population. It's a good achievement. Yeah, good achievement, yes. Then coming from registration of members, I'll talk about the accreditation of facilities is our other mandate, so that when we have members on the scheme, they are able to access the services at these accredited facilities, which include hospitals, diagnostic centers, pharmacies, and many more. So then our other mandate is to develop a comprehensive benefit package. So the comprehensive benefit package, this stipulates what our members are entitled to access as services. For example, surgeries, vision care, maternity, so and many other. So this is our mandate, and we review this benefit package on regular intervals, usually annually. So right now we are reviewing our benefit package with different stakeholders. Then I also talk about our other mandate of developing a communication strategy. So that communication strategy enables us to develop a robust message for the National Health Insurance Scheme, so that we're able to spread the message for the National Health Insurance Scheme to the Zambian citizens in terms of the benefits of being on the scheme, and what they need to do to become registered on the scheme. So I think these four are our mandates which are relevant for our discussion today.
Awesome. Now let's speak to the fact that Zambia recently was faced with a hurdle. There was the El Nino, the drought, and so on and so forth. How is Nhima interpreting this year's theme, that is adapting to climate change? And obviously, we have seen there was a cholera outbreak just recently. A lot of pandemics probably, or outbreaks have come through. How is Nhima interpreting this year's theme with regards to the theme itself?
All right, I would like to mention that actually this theme resonates very well with our mandate as Nhima, because we don't look at climate change as only about the environment. We also look at climate change about public health emergencies. Yeah, so we are not just focusing on treating diseases. We are also focusing on future risks. So this it resonates very well, and we are saying we are building a climate resilient health protection system for all. So this is how we are interpreting our theme this year at the Agriculture Show. And I would like also to mention that my colleagues will go into detail to talk about how we are registering, how we are interpreting the theme this year. Thank you.
Now, thank you very much. Well, to you who's watching us from wherever you're watching us from, we're still here at the Nhima stand. Like I mentioned earlier, that we are actually inviting you, encouraging you to come through and make sure that you register or you get on board Nhima, because you don't know what you might suffer tomorrow, or you don't know what disease you might encounter tomorrow. Nhima would definitely help you pay your bills. But stay tuned, because I still have a whole lot more still at the Nhima stand. Stay tuned. Nhima has really brought you all the goodies that they have interpreted this theme with. Now, speaking to me is Michael Zimba, Manager, Contribution and Membership. Now, if you are a contributor, you're a member of Nhima, this message coming from Mr. Michael Zimba is definitely meant for you. Mr. Michael, welcome to the short interview.
Thank you so much.
Let's get straight into it.
Yes.
Internally first, I want to find out, there is policy, a green policy action.
Yes.
Let's also get to find out what exactly that is all about.
Okay. No, thank you. Thank you so much, and welcome to our stand, Nhima. We are here to serve you. To the general public and the entire populace of the climate change. We've also done certain things internally as an institution that is showing an indication of how we are going green. So one of the four major things we've done is we are partnering with a company that gets all of our paper that we throw away and recycle. And then they're able to provide this paper in terms of toilet tissue and all those accessories that come with recycled material. Then also internally we are saying, how can we contribute to the carbon print, to reducing carbon emission and the cutting down of trees. So we are also promoting a clean transport system. We haven't yet acquired or procured any electric vehicle. There are also those logistics and thresholds and authorities that we need to clear. But we thought ahead and said, look, let's prepare ourselves for such eventualities. And we've developed a transport policy, a robust transport policy that speaks to and incorporates climate change. So once these policies are into effect, we should have a situation where we can procure electric vehicles to reduce carbon emissions. Then we've also introduced a smart printing management system within our ecosystem, our work environment. So each person that is able to print, each member of staff is assigned a password, and we're able to monitor usage and how they're printing, and that information helps us track and reduce the usage of paper. Then lastly, we are also going cashless. I'm sure you've done registration before on phone, through the internet. Our registration process is paperless. You are able to do registration at the comfort of your phone, as long as you have all the necessary documentations in electronic form. So internally, those are the steps that Nhima has taken to make our contribution to become resilient and indeed adapt to climate change.
Now, let's go to the major interpretation of this year's theme. I've seen on one of your exhibition here is commitment to a health society as Nhima. Speak to that. How have you incorporated this with this year's theme?
So when we looked at the theme, like my earlier presenter indicated, we are not only looking at climate change in terms of the environment, we're looking at climate change in terms of public health outcomes. So we are looking at what is happening in public health because of climate change. So we've realized that all these floods and calamities that are associated with climate change, they bring about public health issues. I'm talking about diseases that are related to floods, stagnant water, respiratory issues, pollution, and all that. So we've said we need a certain approach from the theme that we can adapt. And we are saying at Nhima, the adaptability is into creating a healthcare protection system that is resilient. So how is this one being done? We've identified that most of the diseases that are pushing our claims are respiratory related, waterborne diseases, diarrhea, and all that. So we've said which part of the population is affected the most. And we've noticed that it's the vulnerable, the very poor, the marginalized, the ones that are living in far-flung areas that can't access some of these facilities. We realize that they need to be taken care of. The very poor themselves, the disabled and the old age. So we've categorized a group that is at high risk to these things that have come due to climate change. So using those risks, we've come up with solutions. 4 solutions to address and to speak to the theme. If I may I continue with okay. So the first thing that we've done is we've said, look, can we come up with smart solutions that are closely related to what we are doing internally? Because remember, we also receive claims from HPCs, healthcare institutions that we deal with. So in the past, they used to send paper for us to process the claims, but because of the system that we've introduced, everything is done paperless. So that's the first thing we've done. Smart systems to reduce on cost and to improve the climate through the reduction of paperwork. We've also encouraged the registration of the indigents. We are saying, can we bring equity? The rich are able to afford, some of them live in urban areas and use other services apart from Nhima. But we're saying that vulnerable person, what can we do? So our research and planning department, through collaboration with other international institutions, we've managed to secure funds from the Global Fund. So the Global Fund funds are intended to assist those that are vulnerable, because some of the billings and the claims that we receive, we are unable to meet them because of certain groups that don't contribute. But with those funds, we are able to reach out to that vulnerable person who's affected by climate change. Then also we've gone to say, look, we have mini hospitals in these places. And those mini hospitals are very important catchment areas for the poor and vulnerable again, and for the rural people that cannot access these facilities in town. So we said deliberately, let's put about policies, because we do policy and the policy will allow for the development of those things. So we said, let's do policy, we deliberately accredit, so in short, registered institutions to be supplying Nhima services. So we've done that as a measure to prepare for the future. Then also, lastly, we've said, apart from those things, what do we need to do with these facilities? I'm sure you know, even in Lusaka, when you want to get CT scans, MRIs, we have an issue where some MRI equipment is broken here, so you need to access it somewhere else. So we've said, let's procure some of these items within our mandate and supply these to various hospitals across the country, so that we're able to get that diagnostic that we want to bring about a proper prognosis and to lead to a patient to recover. So we've also done that. We are procuring MRIs and CT scans for mini hospitals. So those are the 4 main areas in which we're adapting and preparing for the future eventualities where the vulnerable and marginalized will not be able to access this service because of these calamities. So we are preparing to have those things in place. So as the population grows and time moves, we're able to meet those demands. So essentially that's where we are adapting the theme from, and that is what Nhima is doing.
Awesome. Now, Mr. Zimba, before I let you go, I want you to speak to, I've seen their services being offered right here at the Agriculture and Commercial Show. What are some of the services that those who are listening to us, watching us right now, can access at your stand today?
Okay. I think I should speak to a very important activity that is currently going on. I'm sure some people have received phone calls myself from people who know me, obviously taking advantage. Said, no, I know the manager, so he's able to resolve some of these things for me. So what we are doing now is we're doing KYC. We are updating all the details in the system, and some members, I should make mention that when they go to facilities, they may have a small hitch concerning their data. There are some missing parameters and records that we need to update. I mean, other institutions have done it before, the MNOs, other social security institutions that were offering certain nice benefits. We are doing that update. So we are also updating our KYC, and if you come to the show, you present your NRC and you're already registered in the system, we're able to check for you if there's a missing something, a cell number, maybe your NRC, you didn't upload it nicely. We're able to do that exercise. Apart from that, we're doing the usual activities. We're doing registrations, we're doing corrections, we're doing card capture, and basically just disseminating all the necessary information about the location of our healthcare providers and everyone that deals with Nhima. So that's what we are offering here, apart from interpreting the theme and showcasing what we do.
Well, Mr. Zimba, thank you very much for according us this opportunity to speak to you. Awesome. Well, to you who's watching again and listening to us from wherever you may be right now, make way to this year's Agriculture and Commercial Show and get to find out what Nhima is doing. And well, they've spoken to the fact that health impact on climate change. They've definitely told us what the future looks like and also what internally they're doing in collaboration with this year's theme. My name is Victor Mwanza. At the Nhima stand, it's on to the next.